Welcome to In Conversation. I'm your host, Steve Iverson. Our guest today is Roberto Olivardia. Dr. Olivardia is a clinical psychologist and researcher here in Lexington who specializes in a number of disorders, including ADHD, body dysmorphic disorder, and a number of other things. He's a clinical associate at McLean Hospital in Belmont, and also a lecturer in the Department of Psychiatry at Harvard Medical School. And we're very thankful for you to coming in.
Sure, thank you for having me.
You bet. How long have you been practicing now?
So I've been practicing about 16 years now.
Okay.
And my practice started in Belmont, then was in Arlington for a number of years, and then in the last 6 years has been in Lexington.
And whereabouts in Lexington are you?
I'm at 57 Bedford Street, in a very easy, right off 95, close to the center.
Is that the building that's down by the fire station?
Yes.
On Bedford Street? Oh, okay.
Yep.
Yep.
Right across from the Starbucks.
That's convenient.
That's very convenient.
Fantastic. Well, thanks again for coming on.
Sure.
And we planned on talking probably about a couple of the disorders that you treat and topics that you work on. And we thought maybe we'd start off with ADHD, which you hear about a lot in the popular press. It's a popular topic. Apparently, it's a wide-ranging disorder. What is it exactly, and how prevalent is it?
So ADHD, or attention deficit hyperactivity disorder, I would say of a lot of the different conditions that I work with and treat, is probably the most misunderstood. And the reason being that I think a lot of people think that they know what it is, and often there's a lot of misunderstanding. So in a nutshell, it's typically people with ADHD struggle with issues of attention. Now that doesn't mean that they don't or cannot focus. The issue is more of a dysregulated attention. So when it's something that someone with ADHD is very interested in, their attention could be superb. It could actually be better than someone without ADHD.
Okay.
So if a parent says, I don't think my child has ADHD, they're able to play video games for 16 hours straight. Sometimes I say that could be perhaps more of an indicator that they have ADHD, that they're unable to sort of move away from something they're so fixated or interested in. The problem is when you're not particularly interested, and it's a huge disparity. So of course, for anyone, if you're not as interested in something, your attention isn't going to be as sharp. But for people without ADHD, they can still manage and focus on things even if they know that they're not particularly interested. For someone with ADHD, it's really, really difficult. And so they will either retreat into their imaginations and daydream, they'll look out the window, or they will have exhibit symptoms of hyperactivity, getting out of their seats, sort of moving, needing to move a lot. So inattention is sort of one of the issues, hyperactivity, but you don't have to have symptoms of hyperactivity. You can just have the inattentive piece to still be diagnosed with it. But the hyperactivity could be sort of moving around, needing to fidget all the time, having a very difficult time sort of settling yourself. But most of the time what the hyperactivity is a result of is not feeling particularly stimulated. Again, so if you have a child or an adult that loves a particular movie they're watching, they can sit still totally fine. So the hyperactivity is often an extension of that. The other area that a lot of people don't know about is the area of executive functioning. So by executive functioning, we're talking about all of the cognitive processes that our brain does to get something done, to execute a goal. So we need to know how to manage time. We need to know how to prioritize what's the most important thing, the second most important thing. How do we organize things mentally, physically in our space? What is our working memory like? All of these things are things that are highly big issues for people with ADHD. So years ago, actually, and even today in the DSM, which is the Diagnostic and Statistical Manual for Mental Disorders, you don't see executive functioning actually as one of the symptoms for ADHD, but it is definitely how it's conceptualized today is very much an executive functioning condition. So by executive functions also, we're not talking about intelligence. So I work with very intelligent, bright people who could have poor executive functioning. And that could be very confusing, particularly for people who don't know that you can have one without the other. So unfortunately, a lot of people with ADHD might think, well, maybe I'm stupid, maybe I'm lazy. Sometimes their teachers might think that. Or other adults in their life thinking, well, you're clearly not trying hard enough because you're super smart. Like,
right.
We know that you know what to do. But this is what ADHD is. So ADHD is not always knowing what to do. It's about doing what you know. And now, having said that there are also, I think of ADHD as simply the way the brain is wired. I have ADHD myself, and so there are a lot of things that have made getting through school pretty difficult, but it didn't make it like I got through school. I have a PhD, so you could be a good student and have ADHD, but I had to figure out a lot of strategies of getting through, particularly the classes when I was in high school that were not very interesting to me. So, but the other thing with ADHD is you see a lot of people with ADHD who can be out-of-the-box thinkers, who can be risk takers, sometimes in the not-so-good ways and sometimes in the really good ways in life, can be very socially charismatic. So there's a lot of stuff that kind of comes along with it that isn't so bad either. And so I don't have this sort of pathological view as much as that here's a certain brain that you have, and it's wired in a way that could bring you to really good places, or it could bring you down really bad roads. Impulsivity is another category of symptoms with ADHD. People with ADD often lack impulse control. So if they like something, they want it, and that could be with all different things. So I see a number of patients with ADHD of different ages who struggle with a lot of impulse control or addictive behaviors. And it's not just drugs and alcohol. It could be with food. It could be with gambling, with shopping, with internet, video games. So basically the ADD brain craves stimulation tremendously. And there's a lot of biological and neurological research as to why that is. This is all substantiated by a wealth of empirical data.
It sounds like it's actually a very complex disorder.
Absolutely, absolutely. And it's something that I think, because it's in the sort of popular culture, oh, I'm so ADD, anytime someone forgets their keys, they might say, I'm so ADD. Well, forgetting your keys does not necessarily mean that you have ADHD.
Yeah,
it makes you human.
Sure.
But for people with ADHD, that could be a regular occurrence. For someone with ADHD, it could be, I know, I have every intention of leaving my house at 8 a.m. to get to work, but then I'm ready to go out the door and I forget, oh, my dog has to be fed, and I forget this, and then before they know it, it's 8:30 and they're late.
Is that the executive function thing you were referring to?
Absolutely. So that would be sort of these areas of executive functioning. And the thing I enjoy most about working with people with ADHD is there's this huge learning curve that once people come in, especially if they haven't been diagnosed with it before, or if they were diagnosed with it but didn't really have as much of the sort of conceptual understanding of what it is, it's oftentimes people feel like they go through this epiphany of like, oh my gosh, this makes so much sense.
It all makes sense now.
This is an issue for me. Why sleep, which is a big problem for people with ADHD. Why this is. And I break it down, even for young children that I work with, in terms of what we know about the brain and translating research and all of the data that we have into a language that all ages can sort of understand, so it makes them feel validated. Because that was my experience, that when I read the Journal of Attention Disorders, which is a scientific journal devoted to ADHD research, I feel like I'm reading about my brain. This is me. Let's see. How do I sleep? And this makes sense. Why sugar? I love sugar so much. And that there are these things. And when you go to an ADHD conference, which every year it's in a different part of the country, the Children and Adults with ADHD, it's called CHAD, is the organization. They have an international conference. This year it's in St. Louis, and I've been speaking at it for the last decade. It is, and it's for professionals, for parents, for educators. There is a sense of community that people feel of, oh, we all get it. You know, we all understand how, and sometimes it's important to have humor around some of those things, but also it is also important to understand how difficult that can be, you know, for a lot of people, particularly if they're trying the same thing over and over again, but you know, with an ADHD brain, sometimes you need to try something that's out of the box to align with your out of the box brain, you know, in that way. Also, 50 to 60% of people with ADHD have learning disabilities and learning differences, which is very important as well, because sometimes it's more than just the executive functioning and the inattention. Sometimes it's dyslexia, which is a language-based learning disability which affects reading, or dyscalculia, which is a mathematics, you know, disorder, that those things also come along with ADHD.
That sounds like that adds to the complexity of diagnostics and treatment.
Definitely.
And it sounds like you've got to know a lot about a lot of things to treat someone with ADHD well.
Yeah.
And speaking of treatments, we seem to be living through an age of flowering of biological psychiatry, and medications have become more and more prevalent and helpful, but psychotherapy and other treatments are still very important. How would you judge those two approaches to treatment with ADHD? Do they complement one another? Does one help in a different way than the other?
So definitely, so there are some people who, I would say for everyone with ADHD, having the sort of therapy piece is really important. Really understanding how to translate what we know into sort of behavioral practice. Certainly for a lot of the adults I work with, older adults who were not diagnosed as kids, because even, I mean, what we know about ADHD, how it's identified, is vastly different now than it was 20, 30 years ago. I mean, when I was a child, the kids who were diagnosed with ADHD were the kids with conduct disorders, were the kids who, some of whom dropped out of high school, who didn't have very good social skills. Some of those kids were my friends, but I related to them on a number of levels, but I did not have a conduct. So only 25% of kids with ADHD have a conduct disorder, which means 75% do not. But it was those 25%, and it often were boys that were more identified. Girls with ADHD, until recently, it was thought of that boys outnumber girls, you know, 3 to 1, 4 to 1. That's actually not true. That I see just as many girls and women with ADHD, they're not as picked up and as identified, because a lot of times you might not see the hyperactivity. Girls are also socialized to sort of be more polite and more quiet and whatnot, whereas a rambunctious boy is, you know, boys will be boys. And so a lot of so gender socialization also plays into that. But in terms of with older adults, it's really helping with their self-esteem. You know, for a lot of these adults who literally, they just think they're stupid. They think that they're lazy. They think, you know, I've been faking it all these years. I'm not really that smart. I've just kind of been able to. So it's really making sure you're unpacking all of that. When it's a child that I'm working with who just got diagnosed with ADHD, really the therapy helping them create a positive framework around this, that it does not mean that they have a defective brain. It does not mean that they won't be able to accomplish something. I mean, I got an email actually recently from someone in Greece, of all places, who saw me on a webinar. What wonderful technology we have. We can reach out to people all over the world.
It really is.
And he said he found it so encouraging, because I had shared, you know, my story, and he said, I literally counted myself out from ever getting a master's or a PhD, because writing and reading is really difficult for me. And this particular video, I had talked about how I did all my reading, a lot of my reading in grad school on the subway train in Boston, that it's very hard for me to sit still and read. And I found out accidentally that when I was on the train reading articles, I was getting through it a lot quicker. Oh. So I was like, okay, if this is what works. And I used to take Sunday afternoons, and I'd ride the Orange Line from one end of the stop to the other for hours.
That's fascinating.
And I'd read a lot. And you know, anytime I have an anticipated plane trip, you know, November I'm flying to St. Louis, I have articles that I'm saving for that plane ride.
You
Because
get the same effect on a plane?
Same thing. There's something about the movement. There's something also about being a captive audience. I can't go anywhere, when I'm on a plane.
Yeah.
And he found that encouraging. And that to me is just painful when people count themselves out of opportunities, because you don't have to count yourself out of anything. But you do have to accept that this is the way that your brain is oriented. You have to accept that. And so that's a big part of the therapy. And dealing with potential associated issues. 30% of people with ADHD struggle with anxiety, 20% struggle with depression. Again, impulsive and addictive behaviors are very common in people with ADD. So the therapy piece helps with that. Now, medication can also be extremely helpful. Now, not all of my patients are on medication. Some of them have tried it and it didn't work for them. Some of them tried it and it helped their ADHD, but it might have exacerbated their anxiety, for example. So they decide not to take it. And then a number of them take it and they say it's absolutely life-changing. Yeah. The category of medications are the stimulants, so things like Ritalin and Adderall, which, for people hearing this, does not do the same thing to the ADHD brain as it does to a non-ADHD brain. So when we hear, there's stuff that's floating around in popular culture about, people abusing Adderall and it's this illegal drug and how can you have your child be prescribed this, is that to someone without ADHD, it is speed. It's an amphetamine.
Sure.
To an ADHD brain, it does the opposite. It stimulates focus and it stimulates attention. It does not stimulate their activation and sort of making them more hyper. It does the opposite.
It stimulates other facilities in the brain.
Absolutely.
Okay.
So it grounds them, and what I tell patients is, of all the class of medications, stimulants are actually the ones that you can actually tell pretty quickly whether they work or not. You can tell the day you take them whether they work.
Oh, it's not like an antidepressant where you have to wait 4 weeks.
Exactly.
Okay.
Exactly. Literally the day you take it. It comes in quickly, it washes out quickly. If it doesn't work, you stop taking it, it titrates out of your system very quickly. And for some of my patients, it's been life-changing. I mean, that they say, oh my gosh, I can actually sit and I have this intention of getting this task done, and I actually can get it done for the first time in my life. I'm able to sit through a class and hear a teacher and hear the lecture, throughout. Even in research, interestingly, I work with a lot of men with eating disorders, and there's a high association with ADHD and binge eating disorder, sort of impulsive, overeating. Now, interestingly, the Food and Drug Administration just approved a drug for binge eating disorder, and it's a drug called Vyvanse, which is an ADHD stimulant. Wow. So it's not a coincidence that you sort of see that. And I have patients who have ADHD and binge eating disorder who have struggled for years, and they go on this medication, and they say it's just unbelievable. And it doesn't reduce their appetite as much as it regulates their appetite, and it gives them that proper pause of, okay, do I really want to eat, all of these calories? And that's also what stimulants can do. So sometimes, particularly with children and adolescents, they might take what's called like a medication holiday. So when the school vacation over the summer, they might not take their medication if the medication's primary focus is to help them with academics. But a number of kids I work with, it's year-round, because ADHD is not just an academic issue. It really affects every life domain. And so if you have a child whose emotions are very dysregulated, who has really poor impulse control, that medication could be very, very helpful in just giving them that proper pause. But again, having said that, not everybody takes medication, but the therapy piece, I would say, is essential to really succeed with it.
Okay, and there's a lot of different kinds of psychotherapy, I believe. And for the longest time, I believe what's generally called psychodynamic psychotherapy was sort of considered to be good treatment for almost anything. That's maybe changing now. Does that have a role in treating ADHD, or is it a more esoteric, specialized form of psychotherapy?
So with ADHD, it would be, I would say, primarily more what we call a cognitive behavioral therapy. Okay. So that would be maybe even initially a behavioral therapy of, what are the certain behaviors that you want to execute, what are the behaviors you don't, want to execute, and what are specific skills that enable your intention, basically. The cognitive part would be watching and being mindful of self-talk that people have. I can't do this. This is too hard, therefore I can't do it. And challenging those negative thoughts and saying, something, you can feel that something is hard, but it doesn't mean you can't get through it. But maybe we can figure out strategies. Like I often think of what I find exciting in patients as well is that you feel like you're kind of strategic in dealing with ADHD. I love that word, strategic, and
it has a nice ring to it.
It does have a good ring to it, and I've always loved when I figured out a technique, like when I figured out that technique of riding on the train, I felt like I had discovered a pot of gold. Like it just felt like, oh my gosh, because I actually did my own experiment and I was reading 7 pages to every one I was reading in my apartment at the time.
Wow.
So when you can boost your efficiency by just doing a simple thing as just hopping on a train, it's exciting. Like there's this incredible, so that's what I do with a lot of patients in figuring that out. Now the psychodynamic piece, or the more kind of interpersonal talk therapy piece, is also very important because I would say the first piece of work, really, the first chapter is going to be more that, which is how do you feel about having ADHD?
Okay.
What does this mean to you? Because if I have a patient that thinks I have a bad brain, I have a defective brain, no behavioral skills, no strategies are going to do anything unless we deal with that. Because if you believe that, because what happens is that if I'm giving you behavioral skills that are saying, okay, you might have to do this differently than Joe and Mary next to you, well, if you think you have a bad brain, now that skill is inducing shame in you, which is what we don't want. So the talk therapy piece is important to really, what is your sort of conceptualization of the ADHD, and what does it mean to you that you will be doing things differently than your peers? But it doesn't mean you can't arrive at the same spot. That's the end goal is really, what we want. But for a lot of patients I work with, they have a very hard time, like, why can't I just be this way? Why can't, and so the talk therapy piece is really important in dealing with that. And then once that, someone can buy into it, and I have to say, younger people I work with are a lot less stigmatized around ADHD than even what I would see 10 years ago, and certainly with adults that I work with. And I think partly because most kids that I work with have friends or know of other people who are also diagnosed with ADHD, and it's not this dirty little secret, in some ways. Yeah. So in a way, that part is actually, I'm finding is getting easier as the years go on, really helping people understand. And the kids I work with, they're like, yeah, that's fine. I don't care if I have to do it this way, as long as I get it done. Whereas a lot of the adults I work with in careers where their ADHD might affect their careers, they really beat up on themselves really harshly.
There seems to be more of an openness, especially with younger people now, to recognizing and talking about mental health issues, mental health problems, I think. Maybe that's just because we're learning more about it all the time and it seeps out into the general population. But that's certainly got to be a good thing, I would think.
Oh, absolutely. Yeah.
You have fewer people privately believing that they're defective in some way and only they are like that and feeling terrible about it.
Absolutely. That I think with, one of the things that I love about social media and the internet, that on one hand, I'm glad I didn't grow up with it because that would have been one of my impulse control issues. But one of the wonderful things about that is this dissemination of information, like that man in Greece who he doesn't know anyone, he said, in his community that even knows about this, and he's hearing these webinars of people who are echoing to him what he knows about himself. And with younger people, you have a lot of celebrities that are out there and talking about, not just addiction, but bipolar disorder, eating disorders, obsessive compulsive disorder. And I'm seeing that impact. So where younger people are not as shamed about it. We still have a ways to go with it, but it's I would say, dramatically different than 15 years ago when I started, with this.
At one time, most adults, including celebrities, might have done everything in their power to keep people from finding out about a problem like that, and now they're talking about it, and it is very helpful. I agree.
Definitely.
Or it seems to be, to me.
Yeah.
We've got just about 5 minutes left, so I wanted to make sure that we also talked about how does somebody find help if they believe they've got ADHD, or if they know they do but they don't currently have anyone helping them. What's a good way for people to find the proper treatment for ADHD?
So there's some websites I would highly recommend for people. So I'm on the scientific advisory board for Attitude. So that's spelled ADD, I-T-U-D-E. So instead of attitude, it's attitude, like ADD.
With ADD.
Yeah, and it's attitudemag.com.
Okay.
And there's a physical magazine, but they have a fantastic website. And I fell in love with that website as a parent. I have a child, a son with ADHD and dyslexia, as a professional, and then they asked me to write articles for them, and then I got on the board, and it is a wealth of data, of free webinars, of short articles. They know their audience well. The articles are short and sweet, and bullet point.
That's very savvy.
It's very savvy. I would highly recommend that. There's another wonderful website called understood.org.
Okay.
And understood.org also does a lot of great education on ADHD and learning disabilities. CHAD, I believe it's chad.org, so it's Children and Adults with Attention Deficit Disorder. They are sort of one of the national umbrella organizations. They're the ones that sponsor the conference every November. Their website is great. For adults with ADHD, there's an organization called ADDA. It's ADDA, or the Attention Deficit Disorder Association.
Okay.
And these are all... The wonderful thing about ADHD that I have to say, compared to a lot of other different conditions and diagnoses that I work with, is they do a really good job in the ADHD community of putting information out in those kind of platforms, because they know their audience, is that's going to be more readily digestible than maybe picking up a 500-page book, on it. So on those websites, you'll get a lot of information. And then I know with CHAD, they have a treatment provider database. Depending on what state you live in, you can plug in your state, and it'll tell you people in your state that have expertise. ADDA also has that, and I think Attitude might have something of that nature as well. And then certainly, if people are looking for resources, you can feel free, my contact information to email me, and I'm more than happy to direct people to, the proper resources. But the education piece is so key, and all of those websites are great.
We can we put your own contact information at the bottom of the screen?
Sure.
On this?
Absolutely.
I believe Terry can make that happen.
Absolutely.
So people could contact you and say, can you give me advice on how I can find somebody or something like that?
Definitely.
Okay.
Absolutely.
Fantastic. And what is the when you talk about a disorder, you also talk about recovery. How effective is treatment generally for people with ADHD? Do most people make a remarkable improvement with the right treatment, or is it half of the people, or what do we know about that?
I would say it is absolutely, most people make an incredible stride in progress once they get the proper treatment. And that's, again, what's so exciting about it, in working with people, because it really is getting the right education, getting, for some people, the right medication, and keeping in mind that there are also different kinds of medications, and one might not work for you, but another might. One dose might not work, and so sometimes it can take a while to figure that out. Working, with an expert, someone who knows and understands ADHD, and it's really amazing. I mean, you see, people who never thought that they could do X, Y, and Z, who are doing it, whose lives are improved dramatically. So it's something that has a very, very high progress rate when somebody has the right treatment.
And does that reflect advances in better understanding of treatments? Could you have said the same thing 20 years ago, or have things changed a lot for the better over that period? I know sometimes there are breakthroughs in fields, understanding treatment.
Definitely.
Has that happened in this field, or is it?
Oh, absolutely.
Okay.
That I would say 20 years ago would be a little bit of a different picture. Our understanding of ADHD is still, I mean, it's, again, so exciting, you know, when I get the Journal of Attention Disorders and I read just all of the research now of how we're understanding the brain, how we're understanding genetics, because also, you know, ADHD, the apple never falls far from the tree.
Okay. All right.
So if you have ADHD, it's like it could be a 70% chance you have a child with ADHD.
Oh.
So it is highly heritable.
Oh, I see.
Now, mom and dad might not have been diagnosed with ADHD
Right.
if they're in their 40s and 50s, because again, how we diagnosed it 30, 40 years ago is very different than today. But when you sort of, you know, get a family history, it becomes very evident. And sometimes it's interestingly, the kids I work with always joke, they're like, yeah, I know my mom has ADHD. She doesn't know it.
She doesn't know.
I know she does. So that's also important for families to also be aware of too, because, you know, a lot of times this is a family, particularly for children and teens that I work with, it's a family, it takes a village, you know, in that way.
Yeah.
But sometimes when I'm working with a child, the parent might not realize, wait a minute, like I can relate to a lot of this, and then they go on their own journey sometimes, you know, of discovering and understanding that this is sort of them, you know, in that kind of way. But absolutely, I mean, what we know about it now with brain research, with genetic research, with the strategies that we have with medication, it's far different than what it was 20 years ago.
Very, very encouraging.
Yeah.
Unfortunately, we're out of time. It went by very quickly.
Yeah.
But thank you so much for coming on.
Sure.
I'd like to have you back to talk more about the other things that you specialize in.
Absolutely.
I think education about this stuff is really, really very important. And again, we've been talking with Dr. Roberto Olivardia, and you've been watching In Conversation. The show is directed by Terry Samaras. Thanks for watching.